Hi, I'm Dr. Betsy Buchert. If you're watching this, you're interested in learning about mental health and how we provide functional medicine services for our patients. So that's what we're going to learn about today. We're going to talk about things a lot in regards to hormone issues because a lot of people do come to us for that. However, I am going to explain how we utilize the functional medicine process to branch out into many different areas of concern. Alongside me, you'll be able to view some of the slides I'm referencing as we talk through everything today. So first off, why do I care about functional medicine? And when I say I'm also referring to myself and Renee, the nurse practitioner that works with me at Mental Health, providing our functional medicine services. We've both gone through a very long extra training process beyond our standard medical training, which for me was OBGYN. For Renee was hematology, oncology, as well as family practice, in order to be able to provide better services for our patients. As with many providers, a lot of the journeys we go on begin with personal journeys, and that was definitely the process for both of us. For me, I had a lot of cleanup to do after fertility treatments and childbearing, other health issues that run in my family, insulin resistance, stress impacts from being an obstetrician and missing a lot of sleep, diagnosed myself with subclinical hypothyroidism, have learned how to recover better from nerve and back injuries, post-COVID, hair loss, aging, longevity. All of these things are personally important to me and things that I couldn't have gotten the way that I wanted to with a regular medical process. So it's always helping ourselves, and through that we really learn what other people want and desire that they're missing and are better able to address those concerns. Also for my family, just having 4 kids and trying to figure out how to protect them better from environmental endocrine disruptors, environmental toxins that we're all exposed to. We even call ourselves living in Cancer Alley here, unfortunately. We can't change all of our environment, but we can definitely change how our bodies respond and deal with them. In my family, we've struggled with ADHD, anxiety, allergies. None of these things go away, but we certainly have lots more tools to deal with them, and I very much enjoy sharing that with other parents, other people, other patients. Before I learned functional medicine, when I was practicing OBGYN, a lot of times my patients would say, well, what else you got, doc? And I would be like, well, that's it. That's it. That's what we do, and that's what we know. And really what so many people are striving and looking for is, how do I, yes, treat this now with whatever medication or standard treatment I may need, but how do I make this process better in the long run? What can I do if I want to take less medicine or no medicine? And how can I just really make myself healthier rather than just treating the illnesses that have come about? And that's what functional medicine is all about. So some images that we use a lot when we're explaining functional medicine to people are our functional medicine tree and our functional medicine matrix, which you'll be able to look at with me. So functional medicine, it's not about getting rid of all the things that we do in regular medicine. We're trying to get the best worlds from all over the place, whether it be, using prescriptions, using nutrition, using herbals, using specific nutrients, using therapy to address our mental and emotional state, spirituality, movement, all kinds of things combined, so it's really a whole body approach. And these images really help to explain that. So at the top of the tree, you see kind of all of these specialties that we have in conventional medicine. So endocrinology, cardiology, pulmonology, urology, where rheumatology, it could be obstetrics too, our issues fall into these areas, and those are the doctors that we go and see. And that's great. We need to do that. We definitely support that and want people to have access to those things. On the flip side, and at the same time, you can also come up from the roots of the tree, which is what we're really trying to do in concert with functional medicine. So you can see at the very bottom of the tree is your sleep, your nutrition, your exercise, your stress levels, your relationships. I always say to people, that's the base of your pyramid. Not that everyone's going to get those things perfect, but if you're completely ignoring any of those areas, you're going to derail yourself all the time, no matter what it is, whether you're dealing with coronary artery disease, a rheumatologic diagnosis, a thyroid issue, if you're not addressing those components, you're just really kicking yourself in the booty very frequently. And there's a lot more specifics in between there, a little bit better described by the matrix. So this next image that we call the functional medicine matrix is really the clinical pathway that we use, and that's what functional medicine is all about. It's not so much about the specific therapeutic interventions, because we'll pull those from any area of medicine that we need to. It's really the thought process of how you go through helping a body be as well as it can be, recognizing that none of us are perfect. We don't strive for perfection. That's actually quite counterproductive. It's just getting as best as we can be and finding the right balance of effort and reward and quality of life, and being able to live as joyfully and resiliently as possible. That's always our goal. So again, at the base are your modifiable personal lifestyle factors, and you just simply can't ignore them. So many people come in and say, oh, it's my hormones, I have this and I have that. And I'm like, well, how are you? One of my first questions is, well, what is your nutrition like? How do you approach that? And you're like, oh, I'm so addicted to sugar, I can never stop. Well, we got a problem there, right? Like, it's not gonna work. We need to address that, and we need to figure out, why is that present for you? So we can't ignore any of these factors. They are the base of our pyramid. And then in the center, also super important, is our mental, emotional, and spiritual health, because that impacts our capacity to make decisions and change so much. So for many people, we struggle with food addictions. It's not even just sort of like alcohol and drugs and cigarettes. Those things are less common, but many people struggle with devices, with different junk foods, with activities that are not useful or fruitful to their life. And so being able to work through that in a just slow, progressive, comfortable pace is really, really important. So a lot of times we'll help people deal with trauma history, things that helped happen to them when they were little. Not that we personally deal with them, but point out the need, hey, this needs to be addressed for your autoimmune disease process to get better. Your stress response, hopefully can improve. Why is it set like that in your body? What happened when you were little? And there are many, many providers in the mental health arena that specifically approach trauma that way, and we can help you find it. And then surrounding this are all of the areas of clinical imbalances that can be present that we just systematically work through that create health in the body: mitochondrial health, immune health, gut health, microbiome, how we assimilate nutrients into the body. It's not just what we're eating, it's how our body takes them up, how our hormone systems are working, how our vascular system is communicating. So we just go through all of these things over a process of time. That's why Renee and I don't practice a la carte functional medicine. We ask people to engage with us over time for at least a year, because you can't just do labs and get information and walk away. It's just opening up Pandora's box, and then you will feel completely overwhelmed and not know what to do with it. And it's also our goal to help people make change for life, not just to, come in, get some information and walk away. We want to see things improve as much as possible in a way that has sticking power. And of course, again, everything's not going to be perfect all the time, but we don't give up and we don't quit working on things. So as I said, at Mint Health, we very much utilize the functional medicine process and an integrative medicine approach. We are not against any other doctors or what they do. We are conventionally trained medical providers. We're not against cancer care. We're not against surgeries. We're about helping people understand better how to utilize all of these elements together, as well as how to support your body in the healthiest way possible. And we're teaching a lot. So people do have a lot of responsibility to take their action steps and to really pour their soul and resources and make this a priority process, at least for a little while. That's why we call it having a functional medicine intensive process with us, because you go through an initial intensive year or two, of course, keeping in check what else you have to do in your life. You have to go to work, take care of your kids, all of that in balance. And then it gets easier over time. So like I said, we're going to dive deep into how we may work with someone who feels he or she has hormone problems. But I do want to go a little bit over just common things that people seek out functional medicine care for alongside their current standard or other treatments that they're doing. So skin issues, arthritis, a lot of autoimmune concerns, autoimmune thyroid, Hashimoto's, for example, rheumatoid arthritis, lupus, cancer risk reduction is huge. And then also after cancer treatment, how do you clean the body back up? How do you reduce your risk of recurrence? And there's a lot of things done in conventional medicine for that, such as taking tamoxifen after you've had breast cancer, but also learning how to use certain antioxidants and fasting protocols, mitochondrial support that also decrease that risk for you down the long term. Chronic allergies, digestive issues, especially IBS, and IBD can be really responsive to functional medicine processes. Fatigue syndromes, fibromyalgia is a huge one that we help a lot of people with. Chronic headaches, trouble sleeping, metabolic syndrome, and then of course hormone balance is one of my favorite. So let's take a little bit deeper dive into what we mean by that. Hormones encompass a lot of things in our body. A lot of times when people come in and they say, hey, all these things are happening, something's wrong with my hormones, and they're usually thinking about their estrogen, their testosterone, progesterone, and then maybe I don't even know what they're thinking. But there's so many things involved: insulin, extensive evaluation of thyroid, cortisol, stress hormones. Hormones are impacted by every area of the clinical matrix, and they in turn impact everything else, so they're a very important intervention point for us. Why do we care about healthy hormones? Well, even as a gynecologist, there's a lot of issues or diagnoses that are surrounding this central concern. So we know that there's a lot more obesity in our population, and even more concerning is how that's increasing in childhood because of children's exposures in the womb, which we'll get a little bit into detail more later, and I'll give you some evidence supporting that, some scientific data, that their exposures to maternal metabolic states, maternal microbiome, endocrine disruptors from the environment that crosses through the placenta, it doesn't filter everything out, some things, but not everything, is changing metabolic expression even for us humans when we're fetuses. And so that intervention point has to be so much sooner to really make a dent in our, true public health crisis that we have. Early menarche, many young women are going through puberty early, and there's implications for that. The longer we are exposed to estrogen over our lifespan, the higher the risk of hormone-dependent cancers later in life. PCOS is a huge one, and there's a big array of things that fall under the diagnosis of PCOS or polycystic ovarian syndrome. Lots and lots and lots of young women come to me for this specific concern, whether they're age 14 or age 40, that they've been dealing with these issues all of their lives. And it really truly breaks my heart to see how many young women are struggling with this, because it used to be that it was very much associated just with being overweight and then the problems that would come from that. Now there's a lot of other expressions of polycystic ovarian syndrome that have to do a lot with earlier life exposures and how our epigenetic expression gets set. So my evaluation is a little different than what I would do just as a gynecologist, although they do really work together. Breast cancer, heavy cycles, painful cycles, fibroids, all of these things, gynecologic diagnoses that have roots in hormones, but then in functional medicine, we take it to a much, much deeper level. Also, almost all the time when I'm seeing women, they've seen other people, unless it's a mom bringing in her daughter or a friend's, best friend told her come here and they hadn't seen a gynecologist yet. Most people say, I'm struggling with this. My labs were fine. I think something's really wrong with me. I haven't really been given a lot of answers except take a birth control pill to make your cycle regular. I can't believe that everything else is normal. And I say, well, I love digging into things, so we can definitely find some more areas for you to address for sure. There's an endless way to go. So one thing we have to remember, and when we look at our tree and our matrix side by side with the areas that come into play to disrupt hormone balance, because it's not just me giving you a pill to fix it. it doesn't really work like that because there's so many other things that come in to causing hormone dysfunction in the body. Inflammation, chronic infections, environmental toxins, altered biotransformation, which is the medical term for detoxification, not a lot of people hear, poor sleep, acute and chronic stress, gut dysbiosis and hyperpermeability, which people call leaky gut. You may have heard that, but the medical word now that shows up in even all the GI journals now is hyperpermeability of the gut membrane. Nutritional insufficiencies, genetic tendencies, poor diet, allergies and sensitivities, insulin imbalances are huge. All of these pour into the middle, creating hormone dysfunction. So if you're not thinking about all of that, then you're really just kind of trying to throw a blanket over it rather than really understand how to address stuff from the root, I'll say causes. Because even savvy people come in and say, doctor, what's my root cause? And I'm like, causes. There's going to be a lot of them because we have complicated bodies and we live in a very, very complicated environment. So it's also really important to know that within our hormone systems, all of those components are connected to each other. So a lot of people will see, oh, you know, they're OBGYN for PCOS, and then they'll see an endocrinologist for the thyroid, and then they're seeing their primary care doctor for the insulin resistance and metformin prescription. And so while that's all fine and good, when I'm looking at hormones, I'm going to look at all of those things. And when we talk about it, we're going to talk about how they're connected. What's sort of the first tier approach? If you fix this, maybe this will get better by itself. A common thing that gets missed is borderline and subclinical thyroid problems. Lots of people have thyroid struggles that are not diagnosable clinical hypothyroidism, and a little bit of either direct hormone correction or using minerals and stress reduction and monitoring those labs to make sure they get better over time is extremely useful because it changes how our bodies create and respond to cortisol, and it also changes our sensitivity to estrogen as well. So it's important during perimenopause and menopause times too. We always want to look very deeply at the thyroid. So in addition to subclinical hypothyroidism as an example, another extremely common thing that comes up for people is estrogen dominance. And this summary actually adapted from the Cleveland Clinic. So this is part of regular medicine. It's just not something that gets talked about enough because it's complicated and it's hard for people to fully address meaningfully in their body. So estrogen dominance, it's not just having too much estrogen. It's whenever we have imbalances between estrogen, progesterone, and even the interplay of other hormones in the body. Because you can have normal estrogen, but if your stress levels are high, you're going to be not producing enough progesterone to counterbalance that estrogen, and you still will end up with an estrogen dominant state, which is absolutely not something that you want because that, again, is connected to estrogen dominant cancers, most commonly breast cancer, which 1 out of 8 women have, and most people that get breast cancer do not have a family history. So when people get concerned, oh, I have such a family history, but it's more commonly coming when there is no family history from environmental nutritional concerns and how they interplay with our body and hormone balance. So sometimes we make too much, but often we're retaining too much estrogen because our biotransformation processes and our gut biome are not supporting us in the right way. You need a lot of fiber to properly excrete estrogen. You need different nutrients to support the enzymes in your liver that help you biotransform and eliminate estrogen. The microbiome comes into play. So all of those things have a big role in estrogen progesterone balance in the body. Stress levels are huge because, like I said, when your stress levels are high, and I'm going to show you some pictures of how this happens with the enzymes in your body, you don't make as much progesterone because the hormone precursors are being stolen to go to other areas of what your body thinks is higher acute need, but for the long term, it's really, really bad for you. So I work a lot with helping people understand this. Sometimes it's simply a clinical diagnosis. I see people all the time who have endometrial polyps and mild endometrial hyperplasia, which really those things used to be kind of like PCOS, associated more as a disease of obesity. But now we see that in so many women who are not even struggling with weight or body mass index because of the intense impact of environmental estrogen-like compounds interfering with things, our overall nutritional insufficiencies, gut biome disarray, and all of those things that I was just talking about. So again, everything is so connected in the human body that it's very hard to, even as your own person, understand how do I deal with my health when you can't coordinate what you're getting from so many different doctors, which, hey, it's important because it's impossible for any of us human beings to learn all the details of the medical specialties. But one thing we're doing in functional medicine is saying, okay, well, you have that information from this doctor and that doctor. How do you put it together? And then how do we take a deeper dive into all of those root causes that we've been referring to? I'm going to go through just a few articles for people who are science nerdy like that, just so you can have some things that you can take a look at if you like to read articles and look at data. So this article goes over the effect of antibiotic treatment on the intestinal metabolome. Basically, what that means is we know antibiotics are life-saving. We don't want to die of pyelonephritis and sepsis and pneumonia and all of those things. And as doctors, we are increasingly taught to be very concerned about overuse of antibiotics and resistance. The fact is sometimes you're going to need them and you're going to be very thankful that that medical tool is around, but it's also really important that you have a cleanup phase after. How do you help rebalance your biome? How do you keep your biome robust so that it has resilience when you do need to, have a little napalm come through your body? How do you recover from that? And that's a big thing that we teach people how to do, because even just standard short courses of antibiotics have a huge impact on how your gut is contributing to your hormone balance and how you metabolize and produce steroid hormones. So this is a journal article that goes over that, so you can take a look if that's your thing that you like to do. This is another really great one that talks about how metabolic endotoxemia, so what the heck does that mean? It just means whenever you have gut hyperpermeability, so for example, people who have food sensitivities, gluten sensitivities, which is actually quite common, even if they're subtle, sensitivities to other common inflammatory foods, it impacts the membrane of the gut lining. So kind of like your skin is a very important barrier, that barrier from your mouth all the way to your anus, it's actually outside of your body. There should be a really important barrier between that lumen and your blood and your lymph tissue and all the other tissues in the body that nutrients are being taken to. So when that barrier is impaired because of poor biome issues, toxin exposures, inflammatory food exposures, then certain bacteria-produced substances can just freely flow into the bloodstream. On some levels of medicine, that's similar to sepsis, but this is a very low grade, and it creates just this mild inflammatory process in the body that this article goes over how is that connected to other areas of our health, including PCOS, infertility, pregnancy loss, preterm birth. Because, and those are things that we deal with in OBGYN all the time, and we just, we're giving people progesterone pills and vaginal inserts and taking baby aspirin, trying to maintain these pregnancies. But a lot of the endogenous or your body's own production of progesterone is declining from stress impacts and from metabolome impacts in the gut from these deeper level concerns. So it can be complicated, but it is such an important other point of intervention that can be taken when you've had miscarriages and you're trying to figure out what else can I do? Even if I go and have in vitro, which maybe you have to do that, how can I help my body be able to maintain this pregnancy better hormonally? You may have to really look at your nutrients in your gut and your gut permeability from this angle of things to improve your success of having a healthy pregnancy and a healthy body for pregnancy. I can't say it enough, and this article goes over it, that stress is pro-inflammatory to our bodies and will impact, just like nutrition and gut health, every area of our clinical matrix of our bodies, and it's something that we never ever want to neglect. So as promised, I was going to go over a little bit more detail about how our steroid hormones are produced in our body and how stress comes into play to create disorder here, such as estrogen dominance, low progesterone, high cortisol. So whenever we're stressed, and that doesn't just mean like, oh my gosh, I have too much homework, or work is killing me, or I didn't get enough sleep because my kids drive me crazy. It's also nutritional stress, environmental stress, chronic infection stress. So the way we think about stress in the body and what it does to the enzymes that control all of our hormones has to be pretty broad for us to kind of tackle the problem. But there's many areas that impact the bidirectional enzymes in our hormone cascade that we can intervene on nutritionally, mentally, emotionally, spiritually, from a lifestyle perspective. And this slide is important, not that you understand all the details or learn and memorize every part of it, but just to show you when you're looking at how your hormones transform from one into another, and they can go backwards and up and down from these same precursors. All of our hormones are made from cholesterol that get plucked out of our cell membranes. The precursors have to go one way or the other. And if more of them are going down the cortisol, aldosterone pathway, then less of them are going to go down your progesterone pathways, as well as the healthy estrogen process pathway. So that's how everything kind of gets all disordered in the body. And knowing that and having a picture of it can sometimes help you be a little more motivated to understand what you have to do to help your body be healthier. I love this slide because it really, again, demonstrates the circle that we can get stuck in clinically. And I have hair loss circled because that's another thing that a lot of people show up for. People freak out when their hair's falling out. And there are dermatologic solutions to that, like topical, Rogaine, for example. And sometimes we use a pill called spironolactone. And those are great tools, but without knowing why your hair's falling out or thinking about other things that may be contributing, then you're really not going to have a lasting impact on the problem. So people may come in with hair loss, but I'm going to point out, hey, okay, if your hair's falling out, it's probably either it's an autoimmune process, which dermatologists can help with that, or it's going to be some contribution from stress impacts, nutritional impacts. High insulin is a very common reason that people are experiencing hair loss because insulin drives up an enzyme called 5-alpha reductase, which takes your testosterone and turns it to dihydrotestosterone, which is great for men, but not for women because it makes our hair fall out and makes people grow hair on their face, which nobody wants that. So rather than just, having laser treatment of that, hey, well, let's check your insulin levels and let's talk about how all of that inflammatory process is coming into play so that you can get some more meaningful resolution from it. So as promised, I referred to earlier that we were going to go into a little bit more detail about how many of the areas of the body and health that we deal with in functional medicine, as well as the idea of hormone imbalances, have a huge impact on transgenerational health. So what that means is that when a mom is pregnant, all of her exposures through her life that her body has, not, I say, packaged up and eliminated, but rather stored, because when we get exposed to endocrine disruptors, heavy metals too in the environment, everyone knows about lead and water, but there's also a lot of just lead in our environment all over the place, mercury. Those things either get packaged and eliminated or they get stored if there's not enough nutritional support and resources in the body to pack and delete, pack and get rid of. So those things get stored over time. Those things can have huge impacts for the environment of a developing fetus, as well as the ongoing slot of environmental things that we get exposed to all the time, as well as our nutritional and hormonal and metabolic condition long before we're pregnant with that particular baby. So this baby's developing from the moment of conception in a certain environment. That baby is being impacted, and also that baby to become adult one day, either their oocytes or their sperm cells are being also impacted. So that's the next generation, their children. So that's what we call, the transgenerational epigenetic impact of environment during pregnancy and also other important times or early childhood and puberty. And those things have lifelong impacts. And as a mom, this can get really depressing. It can get really overwhelming and feel very, very burdensome. And I certainly did not know about these things during my pregnancies for my 2 biologic children. I have 2 adopted and 2 biologic. These are things that I started to learn shortly after my 2nd biologic child was born. And I'm constantly thinking back of, oh, well, would this be happening now if I had known this ahead of time? And then I have to remind myself, okay, we can't go backwards in life, we can only go forwards. Nothing's ever going to be perfect. But one of the big things that I really, really want people to at least know so that you can make more informed decisions. Everyone's not going to decide to do the same thing or prepare the same way or have even the same resources, but it's at least important to have the knowledge of, if I really work on having, the best microbial balance in my intestinal ecology that I can, if I really work on my nutrition before pregnancy and have my omegas at an anti-inflammatory level and have really great, B vitamins in my body and mineral balances, and I'm, getting all of the phthalates out of my exposures from plastics, and I'm not using those things in my home, and I'm not putting things on my skin that absorb into my bloodstream that also have deleterious endocrine disruptors. If I'm doing that before pregnancy, I'm just removing at least one piece that I can control, regardless of the environment around us and all the challenges that will come, that might be beneficial to the next generation, specifically your baby. But as a population, it's so important that we all learn how to take these efforts together. So these 2 charts go over that nicely and kind of show you some of the different components that look at it, so you can pause and read some more of those details. And again, there is a lot of published literature to support this idea. World Health Organization has a lot of statements about endocrine disruptors present in moms before they get pregnant, as well as nutritional environment exposures during pregnancies and early childhood that impact issues way later in life: fertility, PCOS, breast cancer, preterm birth. All of those things start much, much sooner than the time at hand, than when we notice it. So this article points out that, and I have this underlined because it's so important, future actions aimed at reducing or eliminating EDC, endocrine disrupting chemical exposures, during the perinatal period are mandatory to guarantee pregnancy success and preserve fetal and adult health. That is a really big statement. To me, every single one of us obstetricians should be screaming that from the rooftops. It should be the first thing that we say to you when we meet you for preconception care, or if we haven't seen you before you've gotten pregnant, at the beginning of prenatal care. And I will say, some patients don't want to hear this. It's hard work and it can be very, very overwhelming. But that is a huge statement from this article that it's something I cannot ever stop thinking about. What I do is I put together a booklet that I give all of my prenatal patients, and when I see someone for preconception, rather than just talking about take a prenatal vitamin, have this genetic test, make sure you've had this vaccine or not, give people those options. It's also providing resources such as the Environmental Working Group Consumer Guides that really can teach people how to eliminate as much of this in their lives as possible because of this reason. That is I'm going to say it again, future actions aimed at reducing or eliminating endocrine disruptor exposure during the perinatal period are mandatory to guarantee pregnancy success and preserve fetal and adult health. And that's just huge. And so why wouldn't that be one of the primary things that we're really trying to do in healthcare? And it's a choice that Renee and I make to try to scream this from the rooftops for people who are able to take action on it. Another article, epigenetic impacts when you're a fetus in utero impact your lifelong hormone biotransformation pathways, and we talked about that being the medical term for detoxification, and goes into that for example, an expectant mother's exposure to BPA, which most people know about BPA and how it lines cans and mini plastic containers at Whole Food, raise the offspring's risk of obesity by reducing sensitivity to a hormone responsible for controlling appetite. So that's a really huge medical statement there as well. So I encourage you to look further at these articles and learn more about them. This is another great article just highlighting how stress during the perinatal time frame, and again, I think back on that of how my first pregnancy, I was finishing my residency in OBGYN and doing night shifts and traveled to Ethiopia and adopted the babies and took my boards, and I can sometimes let myself perseverate on how much impact that probably had on my first biologic child. But again, we can't go backwards. But knowing that moving forward, recognizing how stress levels impact our microbial balance, impact our inflammation levels, and how that epigenetically impacts your baby, who's going to be your child, then a grown-up, then having their own babies, maybe if his or her fertility is intact, has such a long-term impact on human health. Even ACOG stands for American College of Obstetrics and Gynecology, has a bulletin that directly addresses endocrine disruptor exposure as well. And I'm going to read this again because it's such a firm, important statement for this critical area of health and healthcare. So even according to ACOG, that all of us have to get, every year we have to get recertified to continue practicing OBGYN. This statement says, reducing exposure to toxic environmental agents is a critical area of intervention for obstetricians, gynecologists, and other reproductive healthcare professionals. Patient exposure to toxic environmental chemicals and other stressors is ubiquitous, and preconception and prenatal exposure to toxic environmental agents can have a profound and lasting effect on reproductive health across the life course. So how could I not want to stand here with a blowhorn and scream that at everyone until we hear ourselves and at least take the small but profound actions that we can for future generation health, not just our kids, but everybody. So now I ask you this question: when should you clean up your matrix and address your tree of life? So again, we refer back to our functional medicine matrix and our functional medicine tree that explain the overall conceptual approach of learning root causes of health. When should you do it? Now. I mean, always, because even if you feel healthy, undoubtedly these things are impacting you. And if you are planning to have a family, planning to get pregnant, or if you're planning to be successful at your job and grow old and travel and retire, all of these things are impacting you now. And so you want to really learn how to utilize these tools to help yourself. So as you can see, this type of medical approach that we are able to access in functional medicine is pretty different from what we do in most visits. It does require a lot of time and resources, which we're very much committed to giving people options for. What Renee and I do at Mint Health to provide these resources is we offer patients a membership so that we can, in addition to quick visits that are able to be billed to insurance, we can spend a lot more time and communicate the in-depth of knowledge and evaluations that we do in functional medicine. It's very similar to a VIP practice, which most people are quite familiar with. And what we encourage people to do, if you are ready and have decided this is the time for you to engage in the intensive type of process that I've described, you can make an appointment with Renee and she will go over the details with you and describe the process to you as well, and we'll get you set up with that. One question that people do ask us a lot is, what does my health insurance cover? Which we understand. I understand. I pay a lot of money for my health insurance. We know that everyone does. But we do encourage you to think about your body just as important as you consider your car or other material items that you have. So for example, your car insurance may cover you whenever you have a crash, whenever you're having an acute issue, whenever there's a problem. That's not always going to keep our engine running as smoothly as possible. And I even looked up, so what helps keep my car engine running as smoothly as possible? And I put this list here because it made me laugh as to how similar it was to our bodies and how I think about the functional medicine process and the resources that need to go into it. So even just looking up and this is from a car blog, how do you keep your engine running smoothly? Reduce your driving, avoid gunning the accelerator, pay attention to the engine, change the oil and fluids regularly, which made me crack up because one thing we tell people in nutrition is we need to make an oil change in your body. Most people are getting exposed to all kinds of trans fats and things like that all the time, really high omega-6 foods, and we come in and we make an oil change just like you would for your car. Don't store heavy objects, and I was like, haha, like heavy metals in your body and endocrine disruptors. Get periodic tune-ups, meaning dive in before there's a real problem and find an honest mechanic or someone that really cares about how you look at things. So that's one way to think about it. I know it can be difficult. We know when we pay a lot for health insurance, we want it to cover everything we need for our health, but we also have to understand that health is in a challenging place if we only rely on that avenue because it's there for basic screenings, PAPs, mammograms, your annual checkups, very basic labs, which is why people are always saying, I had labs and they're all normal and I still don't know what's wrong. And then accident injury, and if your whole family gets in a car accident, it's really great to have health insurance or you would be going bankrupt. This is a deeper level, which is why we do ask people to put in more resources, and you're going to need to do that. It has to be just as important as your car, as your new TV, as your new iPhone, and the plans that you put on it and the money that you spend for that, the resources and time and interest that you put into your body as well as your children's bodies is just as important or more, of course. So it's helpful to think about it that way when you're structuring your mental framework about the effort and things that you need to put in for yourself. So as I said, when you're ready, because I know at some point you will be, because if you've been listening to me, you understand how important thinking about health like this is for you. We have people scheduled with Renee. You're going to see both of us. We both work with all of our patients because we feel very strongly that multiple heads together is better, and we have a lot of conversations about people's processes. But first you'll meet with Renee because she's not running all over delivering babies like I am, and she'll go through this with you and talk about what your annual investment will be, what that will look like for you, what labs we recommend, can we help you? Some people are not a good fit. Sometimes we feel that something is beyond our expertise, and we have absolutely no trouble telling you that. And we can refer you to someone else we know that's been practicing functional medicine for 30 years that you can work with online. And sometimes we get a feeling that people just aren't ready to put in the effort and their mental headspace isn't quite right. And we'll tell you that too, because when you start, we want to know that we're going to make some level of headway and lasting benefit for you. So that's the purpose of your consult with Renee, and then we move forward from there. So thank you for talking with me today. Feel free to call us with any questions, and we look forward to seeing you soon.